Goa is India's smallest state by area. But what about healthcare? We take a snapshot of Goa's healthcare system, from the shining hospitals in urban areas to the hidden struggles in rural areas. Hello guys, I'm Dr. Mithun. I'm a critical care doctor. Goa is India's smallest state by area, but with one of the high literacy rates and life expectancy. It's a place that balances tradition with tourism, beaches with biodiversity. But what about healthcare? In this video, we take a snapshot of Goa's healthcare system, from the shining hospitals in urban areas to the hidden struggles in rural areas. We'll break down the infrastructure, manpower, emergency services, digital health, and so on. Is Goa's healthcare system truly keeping up with its patients' needs? Let's find out. First, we'll talk about the health infrastructure in Goa. Both public and private sector. First, we'll come to public sector. Goa follows a national three-tier system. It has 31 primary health centers and 171 sub-centers. It is a first contact for rural populations. It is managed by medical officers and auxiliary midwives. It provides basic maternal child care, vaccinations, health education, and basic OPD services. In the secondary level, we have community health centers. They handle minor surgeries, deliveries, inpatient care. The problem is they have outdated equipments and often face staff shortages. When you come to tertiary care, we have the Goa Medical College. It is the oldest medical college in Asia. It was established in 1842. We have district hospitals like Hospicia Hospital, Asilo Hospital. They provide emergency care, specialized care, ICUs, and they do surgeries also. They also have the Goa's Universal Health Insurance, DDSSY, Deen Dayal Swasthya Seva Yojana. It is for all the residents. It covers services in the empaneled hospitals. So the challenges in public healthcare systems are long waiting hours in district hospitals. In rural areas, they have lack of specialist doctors. The number of trained staffs are so less, so the equipments are underutilized. Drug availability is very inconsistent in government pharmacies. Now we'll come to private healthcare system. Private healthcare sector dominates in the urban areas. We have numerous multi-speciality hospitals, private clinics, diagnostic labs in cities like Panaji, Vasco, Margao. They can offer super specialty services like cardiology, nephrology, oncology. They have advanced diagnostics. They do elective surgeries, and also they can provide wellness and cosmetic surgeries for the tourist. The problems are it is more expensive, so it is not affordable for the poor, and they are more profit oriented, and they are dominated in the urban areas, not in the rural interiors. Now we'll come to doctor-patient ratio and manpower challenges in Goa. Goa has one of the better doctor-to-patient ratio compared to Indian average. Thanks to Goa Medical College, which produces doctors annually, and high health literacy and better public health investment. Goa's ratio is 1 doctor per 650 to 800 people. WHO recommends 1 doctor per 1000 people. The Indian average is 1 doctor per 1300 to 1500 people. So the challenge is not the number of doctors. It is a distribution, specialization, and retention. There is always an urban-rural disparity. All the doctors, all the specializations, all the high-tech equipments are seen in the urban areas. Rural areas doesn't have specialist doctors. They don't have the infrastructure and the motivation also for the doctors to stay long-term. Severe shortage of trained nurses in emergency care, ICUs and rural CHCs. Paramedics, lab technicians, and radiographers are also in short supply. Nurse-patient ratio is 1:10 or worse in many wards. The ideal one is 1:4 or lesser in ICUs. Doctors posted in rural areas often takes transfer to cities and private hospitals because of the poor living conditions and training, lack of career growth and specialist training in the rural areas. Also inadequate equipments and staff support in the rural health centers. The rural staffs also face the problem of limited access to ongoing medical education. Goa faces a rising mental health burden. It is because of the lack of adequate number of psychiatrists and psychologists in the public sector. Coming to the area where Goa excels, that is health indicators. Goa consistently ranks among the top Indian states in the key health indicators. This reflects its strong public health focus, better literacy, and better access to care, especially in urban and coastal areas. Infant mortality rate is only 6 per 1000 live birth in Goa. National average is 28 to 30 per 1000 live birth. It's because of the high institutional delivery rate, good antenatal and postnatal care, and also better immunizations and newborn screenings done in public sectors. Maternal mortality rate in Goa is also very low. It's approaching single digit, while the national average of maternal mortality rate is 97 per 1 lakh live birth. It's because of the institutional deliveries, high literacy and contraceptive use, and early screening and treatment of prenatal and postnatal complications. Goa has 88 to 90% of literacy. That is one of the highest in India. So they have better understanding of the disease prevention, more timely health seeking behavior, low vaccine hesitancy, and they have higher participation in screening programs for diabetes and hypertension. The institutional delivery rates are close to 100%. That reduces the maternal mortality rate and the infant mortality rate. Goa ranks high in access to piped water supply and toilets. This directly reduces diarrheal diseases and waterborne infections like cholera, typhoid, hepatitis A and E. Routine childhood immunization is above 90% in Goa. That is because of the effective campaigns they conduct through PHCs and Anganwadis. Goa scores well in sex ratio at birth, female literacy and access to reproductive health services. Women access antenatal care, family planning without much cultural resistance. NIMHANS has partnered with Goa for the mental health reporting for community outreach programs. Substance abuse helplines, abuse centers are functional. While this does not mean lower mental illness rates, it shows higher awareness and help-seeking behavior among the people. We'll take a critical look into the emergency department and critical care in Goa. As I told you, services are better in the urban centers, while rural areas, delayed services and outdated infrastructure are there. 108 emergency ambulance services provide all the basic and advanced life support, but in remote areas, the response time can be very high. The challenges are poor road conditions in the interior areas, lack of trained emergency medical technicians, and also heavy traffic congestion in the urban areas. Goa Medical College has the largest emergency medical department in the state. It handles everything. It handles major trauma, poisoning, strokes, critical services, and medical emergencies. The triage system exists, but overcrowding is frequent and shortage of trained staffs and long waiting hours for the critical cases due to lack of beds. District hospitals like Hospicio and Asilo have emergency units, but they don't have specialists round the clock. CT scans and ventilators are not available 24/7. Burns unit is available at Goa Medical College. It is insufficient in all other places. Poisoning cases are common during farming season, but many CHCs don't have gastric lavage kit and antidotes. Goa sees a large number of trauma cases of the tourist population, but the trauma centers are not yet fully functional as per National Trauma System guidelines. There are only few emergency medicine trained specialists. Emergency department is managed by junior doctors or under-trained MBBS doctors. Critical care nursing is also understaffed and under-trained. PHCs and CHCs often refer emergency cases to the Goa Medical College or district hospitals because of the lack of infrastructure, lack of confidence and legal fear. And ambulances don't have trained paramedics who can manage the patient till the transfer gets over. We'll come to diagnostics and advanced care. Goa Medical College stands as the main diagnostic hub of the state. It provides CT, MRI, pathology, microbiology, biochemistry and histopathology labs. District hospitals also have CT and other labs available, but for the MRI purpose, the patients have to be transferred to the GMC or private hospitals. Now, coming to community health centers, they don't have advanced diagnostic systems like CT or MRI. Only basic things like X-ray and USG are done, and the reports are often delayed due to centralized lab reporting. We'll come to what is missing in the peripheral hospitals. No ICUs or ventilator in many community health centers. No specialty consultation like cardiology, nephrology outside district hubs. Stroke care pathway is not established outside Panaji. Rural patients must travel long distances for the diagnostics and treatment, creating treatment delays. We'll come to drugs and medical supplies in Goa. Goa follows the emergency drug list model in government hospitals and CHCs. Free medicines are available at PHCs, CHCs, Goa Medical College and district hospitals. Central medical stores does the procurement and distribution of medicines. There are stockouts of essential medicines like the medicines for diabetes, hypertension, pediatric formulations of certain drugs, or antibiotics for monsoon fevers. Many centers often follow manual registers in the drug supply. It can lead to over-ordering or under-supplying. It can cause expiry of unused drugs, and also inability to redistribute excess stock efficiently. So patients are often directed to private pharmacies. It is very expensive, so it is not affordable for the poor people. It can affect treatment compliance in chronic diseases. Many CHCs and PHCs don't provide emergency injectables like epinephrine, which is used for cardiac arrest, magnesium sulfate used for the prevention of eclampsia in pregnancy patients, thrombolytics for stroke and MI, and antidotes for organophosphorus poisoning and snake bite. This can lead to preventable death in rural emergencies. Goa is exploring digitalization for real-time drug tracking by e-Aushadhi and similar drug portals. There is also frequent shortage of catheters, nebulizers, dressing materials, and lack of biomedical engineers can lead to broken or poorly maintained equipments in the PHCs and CHCs in rural areas. Goa has started digital health and electronic records. It's a promising start. The e-hospital platform is used at Goa Medical College. Online registration system is used in many government hospitals for OPD bookings. Some hospitals use basic electronic medical records for the labs, pharmacy, and patient notes. Due to the paper-based patient records and manual registers for OPD, immunizations, antenatal care, etc., there can be lost records, inconsistent follow-up, and duplicate treatments. Goa is an early adopter of Ayushman Bharat digital mission. It aims to assign every citizen a unique health ID, digitize health records, labs, pharmacies, patient records. It also creates interoperability between private and public hospitals. We'll come to challenges and limitations in the system. Poor internet in the interior areas. No trained IT staffs in the PHCs and CHCs. Lack of maintenance contracts for the digital hardware. Doctors and nurses are not fully trained to use the digital system. They fear of increased workload due to digital data entry. Some hospitals use e-prescriptions, but in rural areas, manual prescriptions, manual billing, and pharmacy slips still dominate. There is no linked system between the doctor's prescription and the medicine issued. Telemedicine system was also introduced in selected CHCs during COVID-19. The specialists at Goa Medical College also provides telemedicine support to rural areas. But because of network issues and lack of awareness, people don't get access to it. Goa has made impressive strides like high health indicators and growing digital push. But hidden beneath the surface are cracks that are need to be fixed, like rural gaps, manpower shortages, and access inequities. Understanding these challenges is the first step towards a healthier, more inclusive Goa. If you found this snapshot valuable, don't forget to like, share, and subscribe. Let's keep the conversation going, because healthcare system is everyone's business. Until next time, stay informed, stay healthy. Thank you so much.